Good afternoon. Am I visible, audible? Can one of you just tell me? Hey Bhumika, how are you? Can you hear me? Good afternoon. Good afternoon. People are joining in. Let's just wait for one more minute. Okay, so till that time, we can just talk about the exam, right? Till now इतने घंटे बीत गए हैं. Everybody knows exam was relatively on the easier side, not very easy, but yeah, basic minimum they have asked you, right? Probably they were lenient this time, reason being because of the date issues that were going on. So at least I'm very happy that you will get good grades. Most of you will pass with the really good numbers, but that is definitely going to raise the cut off also. ठीक है, सबसे ज़्यादा लोग ज़्यादा अच्छा करेंगे तो कट ऑफ विल बी हायर. ठीक है, सो I have quite a few number of questions for the biochemistry, but I was not really sure of few of the choices. And if you have more detailed knowledge, see, when I'm taking the recall questions from the toppers, right? They know, they don't remember exactly. Nobody could remember the exact wordings from the question paper, but they vaguely can tell, okay, the theme for the entire question was this, right? And even let's say I have to take the exam next year, or maybe after this exam, right? Then what I need to know, I don't need to know the exact question, but I need to know the topic, the relevant topic, because next time they are not going to repeat the same question, but they may ask you the question from the similar topic, right? From the very same topic, right? So that is really my theme of the recall questions is all about. Okay, so you have to help me with the options and maybe the wording of the questions. Okay, there was this question about the Warburg effect, right? Warburg effect, where we have studied in the carb metabolism in relation to the glycolysis, right? And the options what I have is A option, makes cancer cell immortal, required for intermediate metabolites for cell, produce more ATP, and I don't have the fourth option. Probably the fourth option should be all about the glucose, whether it is utilizing the less number of the glucose or the higher number of the glucose, right? And those who are watching my videos, we always talk about this Warburg effect. How do we have to remember the Warburg? War is going on when the patient is suffering from the cancer. ठीक है, cells are dividing rapidly. When the rapid division of the cell is taking place, so what they need? They need their substrate in higher amount, and then they need a way so that they can have the higher number of substrates. So what they do is They take the glucose undergo glycolysis, right? And the end product usually is pyruvate. But in this case, in the cancerous cells, the end product is lactate. When the oxygen is present, because even when the oxygen is present. Why it is doing so? So that it is not looking for the ATP. It is looking for the intermediates that are formed during the glycolysis, so that those intermediates can help during the cell division, right? So there is an increased glucose uptake. There is an increased glucose uptake. See, from this I have told you, right? Initially, usually you get approximately 30 moles of ATP, like in general I'm talking about. But in the Warburg effect, you get 2 mole of ATP per glucose molecule. ठीक है, पहले it was 30, now it is 2, so you have to 15 times uptake 15 times more glucose to compensate for the ATP. So more glucose is being utilized, less ATP is being formed, right? And lactate is being formed. Why that is happening? The answer choice is that is required for the intermediate metabolites of the cell. It helps in the cell cancerous cells division. It does not make the cancerous cell immortal. Okay. No, Bhumika, more glucose is being utilized. See, less ATP is being produced. We are getting 2 moles of ATP per glucose, right? So in order to achieve the real glycolysis ka whatever ATP we are getting, you have to uptake more of the glucose. Okay, you have to uptake more of the glucose. Now there was this question, again a very trivial question. Since last year I'm telling you, even the last year, the high yield topics, the video I have released, that time also you had questions, this time also you had questions from all those topics. Crumpled tissue appearance. What was that? You have the Gaucher glue. Gaucher glue does what? Gaucher glue crumples. Gaucher glue crumples, right? And what is that? That is glucose cerebroside. This was without the image. Is that right? This was without the image. But they probably has given you the growth failure were the keywords. Some students said, ma'am, they were telling about the massive abnormal distension. These were the keywords that were given, right? They have given you some kind of a history, but they are giving you that there was a crumpled tissue appearance and there was no image in the question. And we know for fact, for sure, that is glucose cerebroside. And those who are reading from, who are continuously watching the videos, right, continuously following me, and they are reading from the notes, they definitely have gotten this answer right. Gaucher disease, you have the hepatosplenomegaly, pancytopenia, and crumpled tissue paper appearance, right? The Gaucher disease, that is what we have discussed in the notes also, in the class also. There is what? No cherry red spot seen in the Gaucher disease. So they probably have given you, I don't know, but you have to tell me. But cherry red spot is not seen. Maybe in the upcoming exams they may give you this keyword. Cherry red spot is not seen in where, like in one kind of disease. Then again it will be a Gaucher enzyme. Related enzyme would be glucose cerebrosidase, also known as beta glucosidase, right? You have to know both the names. They trick you using the different names. Okay, very good, Bhumika. Okay, so we have talked about this also, right? That the Gaucher cell has the crumpled tissue paper appearance. Now there was this question, DNA packing is done by DNA packing. Why do we need to pack the DNA? DNA is, this is from the notes which you have studied. DNA is approximately 2 meter long, such a lengthy, like a long kind of a string. Okay, thread hai, itna rassi hai, and you have to pack it inside the nucleus. What you do? You coil it. You can think of the same way how we make a oon ka gola. Woolen sweaters, when we do grandmas, they roll it. Same way DNA is rolled. And how it is rolled? It is rolled using the proteins. So you have 1, 2, 3, 4 proteins. And those are what? Those are your histone proteins. You take 4 of them, club them together, put them side by side, and then you take another 4, place them on top of each other. So So you get a big ball kind of a thing. That is what? That is an histone octamer. Okay, now the base inner core is ready, and on the core you wrap the 2 rounds of the DNA, approximately 2 rounds of a DNA. So you wrap like this DNA on the histone octamers. That makes what? That makes nucleosomes. Histone, right? Do you know the fourth option? There was one option like glycoprotein, nucleic acid, but I don't know the fourth option. Sultan, hi Sultan. Do you know, Bhumika, Sultan, anybody of you, if you know the fourth option, what was the fourth option? Please kindly tell me. Right, so nucleosome is the first smallest entity. It is not a glycoprotein, it is not a nucleic acid, but they may give you other options also. What are the other options? From the nucleosomes, what we make? We make the solenoids, then the super solenoids, then the loop kind of a structure are being formed. These are the various steps. Sometimes they ask you based upon the size also, so you should be knowing the size also. But the smallest entity, first step is nucleosome is being formed, right? And in the previous questions, okay Ankit, that is smart, but at least you should read. They might have given you something very close also. कुछ भी दिया हो सकता है, solenoid दिया होगा, then what you are gonna do? So at least go for the options. Never mind, we got the answer right. Histone was the option. But there are very like other questions are also there related to this topic. What could be those? जो पहले आए हैं, previous recall questions we discussed about, they have given you. They may ask you based upon the size. So you should be knowing about the size also. What other thing? Histone is what? Histones are the positively charged proteins. DNA is negatively charged. That's why opposite sex each other, same way opposite charges, they attract each other. They are coiled properly, right? And that is known as what? That is known as heterochromatin. Heterochromatin does not allow you to do the transcription. You have to switch it to the euchromatin. And how that is done? By acetylation. Okay? By acetylation we do it. Acetylation आएगा, that will help to loosen it up because it is gonna interfere with the charges. वो loosen up हो जाएगा, बड़ा हो जाएगा, थोड़ा space ढीला ढाला हो जाएगा, then the entire transcription machinery can go inside and start doing the transcription. ठीक है? So 3 kind of questions can come from this topic. Okay, now there was this question, 10-year-old male child, right, with reduced weight, height, 10-year-old है, reduced height and weight है, vitamin K deficiency is there, steatorrhea is there. What is the dietary advice? What is the dietary advice? High fiber diet, gluten-free diet, high fat diet, high protein diet. Are these options correct? या कुछ और था? Gluten-free diet, Wasim is saying gluten-free diet. Anybody else wants to try? Right, because of the celiac diseases, steatorrhea happens, right? And because of the steatorrhea, your vitamin K deficiency, the absorption is impaired. Vitamin K absorb नहीं हो रहा है. Also calcium भी absorb नहीं होता है steatorrhea की वजह से. But this is not the right choice. What is the right choice? Gluten-free diet. Everybody thinks gluten-free diet. Why I am feeling that it is a high protein diet? Now we have to check it. It should be high protein diet. Because I have digged into for this, I was confused also for the gluten. I'm not saying कि I am like very intelligent, मुझे सभी के answers आते हैं. I was kinda confused with this question, so I checked with the research papers, the journals I digged into, right? And what I figured it out, the vitamin K deficiency happens because of inadequate dietary intake, also because of the fat malabsorptions or use of the coumarin anticoagulants. This we have discussed in the class also. In this case, they are giving you the vitamin K deficiency is because of the fat malabsorption. Indirectly, they are telling you that. Fat malabsorption might have happened because of the severe liver disease, biliary obstruction, pancreatic dysfunction, atrophy of the intestinal mucosa, or any case like any other cause of the steatorrhea. And it is always it involves the calcium and the fat soluble vitamin ka problem, that is vitamin K in your case. And this is what I have digged from a like really high reputed journal, which is saying what do you need? You need a moderate percent of the fat. ठीक है, स्टेटोरिया है फैट वैसे ही अवॉइड करेंगे. High percent of protein and low percentage of carbohydrate. Usually in many countries they give you the carb. But gluten free is definitely not the correct choice. We should be you can say brainstorming about this. Right. John, C cannot be the choice. Why? High fat diet. Steatorrhea है already. Steatorrhea है तो we cannot give the high fat diet. Stools आ रहे हैं ना इतने सारे with the lipids. Yes, you are getting confused between two questions. This question was more of a nutrition question. So don't get like overboarded कि वो उसमें इतना celiac diseases था, HLA, DQ2 ये सब positive दिया है. You have to focus on the highlights. What are the highlights? Vitamin K deficiency, steatorrhea, and the dietary advice. These are our key points, keywords to figure out. Okay, Bhumika, can you suggest me the question? There was lactose or galactose. See, when you have vitamin K deficiency and steatorrhea, definitely we go for either the high carb diet or a high protein diet, and the supplementation is given for the calcium and the vitamin K. That is for sure. That is for sure. So that is why मैंने इतना सब कुछ दिया है. So answer should come from these points only. See, okay, I guess we are getting confused between two questions, Naveen, Ankur, Ankit, Rahman. I guess we are getting confused between two options. But if it is vitamin K, steatorrhea, just make it sure that if the steatorrhea is there, vitamin K deficiency is going to happen, and also the calcium deficiency will take place. And we do not prescribe a fat diet, high fat diet. We do not give high fiber. We do not give gluten. Either we are relying majorly on the high protein diet, or yes, the carbs is the second next. So if you have to choose from these choices, then the D makes the most sense, because they are not giving the carb. अगर carb दिया होता ना, then we were in problem. Okay? अच्छा, bloating was given. Okay, yeah, Freed, I agree with you. I agree with you, Rahman, Afreed. I agree with you that there are two questions, definitely. If you can share me the questions in any like tuta futa language or any vague things you remember, just do share it with me. So I'll make a final really nice version for this video also. That will help the other students. Okay. Now let's move to the next question. Question number 5. Like there was whole scenario given that what I could figure it out, that there is a factory worker who is working in a factory doing this blah blah blah, right? And ultimately those features were leading towards the lead poisoning, right? That what I have told by the other students. Paint factory worker. Okay, so it was paint factory worker. That makes sense. Okay. Okay, Matish. So vitamin K question was like the bleeding and the easy bruises. Okay, we that is one from the one of the recall questions also. So सबने ठीक किया होगा. I'm pretty sure you all have gotten that answer right. Okay, paint factory worker working since 20 years, right? And they were asking you about which enzyme is being affected. So they have given you the symptoms also. Okay, which vitamin deficiency seen in fat malabsorption? We know the answer, right? Vitamin K deficiency is seen. Okay, perfect. ठीक है. So for the lead poisoning, if you can remember the entire synthesis of heme, there were how many steps? 8. 2 and 8 enzyme was hit by the lead. Okay. Okay, Rahman, I'm getting your point. I guess, yes. The framing of the question that what I have given you is wrong, right? But I'm pretty sure now you know the answer, right? And everybody else who is in this session right now, they are getting that vitamin K and the fat malabsorption. There are the two case scenarios, two different questions. Now, अभी इस पे focus करते हैं. Okay, Rahman, I'll focus on this so that we continue with the session. So what is the answer? Uroporphyrinogen 3, 1, Ella synthase, ferrochelatase. John C नहीं होगा. Why? Dehydratase नहीं है. It's not a dehydratase. It is a synthase. If it was dehydratase, then the C. That's how they are tricking you. Right, Matish? Safikur Rahman, why don't you just tell all these the question of the vitamin K, just send me a message on my Telegram so that I can frame the question very well. Okay. Matish, the question I have is the fat malabsorption leads to the vitamin K deficiency. Since the carb is not given, I will prescribe my patient the high protein diet, right? But there are students, Rahman is saying there were two questions that we all are getting confused between two questions. So let's separate the two questions and then I'll let you know the better choices. You have to give me the choices. You have to give me the proper question. Okay, Matish? So अभी lead poisoning का focus करें, right? Should we do the lead poisoning? It is what? Ferrochelatase and dehydratase. Dehydratase is enzyme 2. Ferrochelatase is enzyme 8. Remember from the class notes, from the Notespedia? ठीक है. First is Ella synthase. It is not inhibited by lead, but Ella dehydratase, which is the second enzyme, and the almost last enzyme I call it, क्योंकि हीम तो बन ही जाता है after 8 step, right? The ferrochelatase, right? These are the two enzymes which are inhibited by the lead. Very simple and straightforward. But जिसने those who haven't read carefully the dehydratase, synthetase, they trick you with the name of these enzymes. That is why every time we talk, every time we are in the class, I always give you the alternate names of all the enzymes so that you are not examiner don't trick you. ठीक है? अभी तो answer is for this is the ferrochelatase. We cannot pick Ella synthase. If Ella dehydratase was there, then C and D both choices were correct. Right, meningococus. Now, complex 4 inhibitors of the electron transport chain. One option was cyanide, another option was carbon dioxide. Do you know other two choices for this question? complex 4 inhibitors of the electron transport chain. Very simple, very simple. And in both NEET PG and also for the FMG मैंने question लिया था. See, my students, they know that you have to give the NEET PG ionized exam, so you also must practice the questions if you have from the FMG. ठीक है, FMG is on relatively easier side for you guys, but that will give you a better idea. ठीक है, FMG के students, they will have hard time solving NEET PG questions, but you as a NEET PG aspirants, they should be able to do the FMG questions for sure, right? That will give you a good amount of idea where you stand. तो जरूर solve करो. Never leave the FMG thinking कि you don't have to take FMG. Take the questions, and they are the questions. अच्छा, oligomycin was there. Ibuprofen was there. Durga, these notes are a book called as Notespedia. You can call the people, DBMCI people, they can help you get the book. ठीक है ना? Answer is the cyanide. Very simple. In both the videos, I have told you this. See, cyanide inhibits what? Complex 4. And in the FMG video, just few days back, we have discussed it. There are complex 1, 2, 3, 4, 5, and the complex 4 is favorite for the examiner. कोई भी examiner होगा, any exam, etc. When etc आएगा ना दिमाग में, they are gonna just pick the complex 4, right? And complex 4 is cytochrome oxidase, CO. CO is carbon monoxide. CO is carbon monoxide. CO carbon monoxide आ गया, which is a gas. So all the gases. Remember this? All the gases. Recall questions में we have discussed it very strongly. ठीक है ना? All the gases, they inhibit the complex 4. If this is oxidase, then the third is reductase. Complex 4 is everybody's favorite. And then what else is another question from the electron transport chain जो बहुत ही favorite है for all kind of examiners. Uncouplers. They ask a lot about uncouplers also, which uncouples oxidation and the phosphorylation. Complex 4 or complex 5. Complex 4 is doing what? Complex 4 is doing oxidation. Hence the name oxidase. ठीक है? Complex 4 is doing oxidation. Complex 5 is doing phosphorylation. Phosphorylation, after phosphorylation you get ATP. And those who break this chain, those are uncouplers. Couple का breakup हो गया. Boys and girls are apart now. Oxidation अलग रहेगा, phosphorylation अलग रहेगा. Right? That is leakage of the protons from the space that is between the outer mitochondrial membrane and the inner mitochondrial membrane. The protons, they don't come via ATP synthase, but they just come in via other channels. So hence the proton gradient is lost. Chemiosmosis theory is not taking place. वो नहीं हो रहा है. Then ATP will not happen, right? And the uncouplers में their favorite is the DNP. 2,4-DNP is the favorite. Thermogenin, yes. What else? Free fatty acids, thyroxine, those are physiological uncouplers. Very good. Really proud of you guys. Now, person with mental retardation and cherry red spot in the retina. Mental retardation. Like I have 5 choices. I know Hunter was there, Hurler was there, and Tay-Sachs was there. But I'm not sure the 4th choice was Gaucher or the Nyman pick. Yes, Bhargava. Really, 2,4 DNP, aspirin, thermogenin, and thyroxine. Really proud. So C is the choice. Tay-Sachs, right? Tay-Sachs is the choice, correct choice, that is accompanied with the mental retardation and the cherry red spot. And in the video, I have told you very clearly about the progressive neurodegeneration, but there is no hepatosplenomegaly. Maybe next exam they give you this, and there is cherry red spot. That is Tay-Sachs disorder, and that is because of which enzyme? कौन सा enzyme? Gaucher. Okay, Naiman नहीं था. Okay, Anju. Thank you, Anju. I should say thank you, Babu. Okay. Which is an enzyme? Enzyme बताइए for the Tay-Sachs. Tay-Sachs. Hexosa. Right? Naiman cut कर दिया meningococcal. I have omitted it out. So Gaucher, Tay-Sachs, Hunter, Hurler. Hunter, Hurler में you don't see the mental retardation. Mind this. Perfect, Shweta. Love you guys. Yeah, Dr. Anish. So Hunter and Hurler. What did I say about the mental retardation? शायद मैंने कुछ गलत बोला. Right? They are with the mental retardation. I cannot recall अभी मैंने क्या बोला. But they both are with the mental retardation. I guess I have said it wrong कि दोनों में mental retardation नहीं होता. दोनों में mental retardation होता है. ठीक है? But how do you distinguish between the Hunter and Hurler? कैसे करोगे? That is another one of the previously asked question in the AIMS. Hurler is autosomal recessive inheritance, whereas Hunter is XR. Okay? So this is how you are going to differentiate. And in the Hunter syndrome, you don't see the corneal clouding. Good. Let's move forward. Hunter with XLR. Perfect. Meningococcal. Now the next question was about the FAD status in the body is determined by FAD. FAD is related to vitamin riboflavin, right? That is vitamin B2. I just know the correct answer, that what student remembered, glutathione reductase level. Yes, Dr. Anish, corneal clouding, very good. So now we are on FAD, so glutathione reductase level. Using these levels, this enzyme level, we can detect the FAD status in the body. Do you guys remember other options? और क्या options थे? Yes, Bhargava, it is B2 for sure, right? Enzyme is glutathione reductase. Okay, Nidhi. Thank you, Nidhi. One option was thiamine, hexokinase, but we know the answer, right? This is riboflavin, that is vitamin B2. And we know that the deficiency of vitamin B2, those who are watching my lectures, is recognized by glutathione reductase. And there are other two important points related to riboflavin. What is this? This FMN and FAD are the two coenzyme forms, right? FMN and FAD are the two coenzyme forms. FMN helps convert in the conversion of tryptophan to niacin, whereas FAD helps to convert vitamin B6 into its coenzyme form, that is PLP, pyridoxal phosphate. Okay, जय, ट्रांसकीटोलेज भी ऑप्शन में था, ठीक है? Okay, Shweta, Devi, all of you know TK because it sounds similar to PK. That is why. But answer is GR. That is glutathione reductase level. Shall we move forward? Okay, now next question was G6PD enzyme deficiency affects which pathway? Yes, Muhammad, you are right. Hexosaminidase A enzyme is deficient in Tay-Sachs disorder. Okay, now the question number 9 is G6PD deficiency affects which pathway? There was this question in which they were talking about a Mediterranean origin kind of a person, but usko primaquinone cannot be given, right? And the question was telling me that this enzyme is deficiency. This enzyme is deficient. So what is the answer? Okay, Dr. Anish, meningococcus, Shweta, HMP pathway, right? Yes, Devi, very good. Rita, very good. Okay, and we have done this HMP pathway and from the notes also. HMP pathway. Okay, this time they have asked you about this Mediterranean person. नहीं दे सकते हैं, and what else can be the question in the previous question papers उन्होंने पूछा है for the aims the fava beans favism is related to the HMP shunt only, and that is also because of the deficiency of glucose 6 phosphate dehydrogenase. ठीक है ना? Because this is a very important key enzyme, one of the key enzymes, and this is the case report. This is the case report in which what is happening is a patient, a malaria patient hai, who was given the drug. Primaquine is an anti-malarial drug. Okay? And then he was showing all the symptoms because he was deficient in glucose 6 phosphate dehydrogenase. That might be another question. So I thought, why not? This is a case study. So I'm presenting you a case study also. Okay? Write it down. He has Mediterranean G6PD variant. Question number 10. Aging is delayed by which of the following? Right? Everybody wants to live longer or look younger. I want to look younger. So I will do what? क्या करूँगी मैं? I will reduce my calorie intake, or I will walk for 30 minutes every day, or I will I will try reduce my stress hormones. What will I'm gonna do? बताओ. If I have to look younger, I want to delay my aging. What I will do? Calorie intake. If I'll reduce my calorie intake. Nidhi says A. Nidhi meningococcus also says A. Hi Zalil, how are you? Come on, join in. You are late. ठीक है? Aging to look more younger, youthful. Calorie intake कम करूँगी. I will lose my weight. Just weight ही lose होने वाला है. Nothing is going to happen. 30 minutes physical activity. Again, I'll be more active. I can say I'll be having a better lifestyle. Good quality life मिलेगा मुझे. If I eat less, if I walk for 30 minutes, it is the stress control. You did the exercise option. नहीं, Dr. Nish, it should be related to stress. If you can exactly tell me कोई hormone name was given or not. It is related to stress hormones, and stress hormones are CRH, cortisol, catechol-colmines, thyroid hormones. इनमें से कोई option था? Have you seen any options? Either these, out of these 4 hormones. Intake of PPI. Why they will give the PPI? I should say I go. It is related to stress hormone. Stress hormone does what? It does a lot of things. Because ज़्यादा cortisol is there, right? They break down the skin collagen and elastin. So beautiful pretty girls, they can have more wrinkles. So don't stress out too much. ठीक है. Thyroid hormones also does the same. It helps, it increases the aging. Okay. So intake of PPI, so directly it was a like very simple, straightforward, big no answer कि नहीं हो सकता है. No. ठीक है. What else it does? The stress hormones, they do what? They decreases, they kills the, or you can say they reduces the telomerase also, concentration of telomerase, right? And telomerase, why do we need telomerase? Because we have to keep the telomere length optimal. Jitna telomere length is gonna shorten out, chota hota jayega, cell is going to die, because the size of telomere tells the age of the cell. ठीक है. Remove hormetic stressor. Okay. See, Harjeet, when I'm not sure what Robbins has exactly saying in what context. ठीक है. Usually it is in related to what context. But out of these four options, when I'm looking at the option reducing 30% calorie intake, 30-minute walk every day, removing the stress hormone level or decreasing the stress hormones level, and intake of PPI, the choice C, that is removing the stress hormones, is the best choice. Is the best choice. Yes, even Lavanya, I agree with you. Jaleel, and others who are talking about the calorie intake, can you share me the snapshot of the paragraph you are reading? It is definitely Robbins, I'm not saying is a wrong book, but they are definitely talking in some context. They are probably, the author is not considering or not talking about the stress hormones level. तभी ही वो आंसर आएगा. If we are considering the stress hormone level, then the calorie intake cannot be the answer for sure. And I can challenge that. They are talking in some context or some reference. You have to read it properly, or just share me the screenshot of the page. Okay. I will talk to Praveen sir that all. After this, I'm gonna give a call. Probably, I'm not sure whether he knows that stress hormone choice was given or not. Okay. And then we both will come to a common point, and then we'll update you guys. Okay. Relationship between telomeres and the aging. There was this kind of a question. Let's move forward. Okay. There are now two ambiguities. Okay. Vitamin K wala question and this wala question. I'll sort it out with the help of you guys. See guys, I am not saying कि किस टीचर ने क्या बनाया था, so don't compare. I don't know how much they know about the options, whether they had this option in their mind or not, कि stress hormone present है या नहीं है. So it's better you go and talk to them, or else I'll go and talk to them that sir, hormone stressor was given, like stress hormone option was there. Now still it is a calorie intake or the stress, reducing the stress hormone level. ठीक है? Then they will, I'm pretty sure they will say what I am saying. Yes, Jay, you can support Shweta. Let's move forward. Okay, we have few more questions to go before we run out of time. Relationship between telomeres and the aging. Telomeres and the aging का relationship क्या है? Telomeres increases the telomerase activity. नहीं. Telomerase increase the or maintains the telomere length. So this is not a choice. Gradually decreasing length of telomeres is related to aging. Aging is due to telomere shortening. Very good. Do you have choice D? That what I have written up on the screen also. And one more thing I have written. Chronic stress decreases telomerase levels, which end up speeding the aging process. Right, Arya, Aryan Kumar, Shweta, Rita Brata, right, you all are right. That is choice B. Yes, Garia S. What is your full name? V Garia S. Your logo is cute, though. Aging is due to reduced telomerase activity. Telomerase activity reduced होगा, it will lead to shortening of telomere, क्योंकि then we are unable to maintain the length of the telomere. So it is, all things are related to each other. Stress hormones का level up होगा, it is gonna decrease the telomerase enzyme activity. Telomerase enzymes are gonna go down, then the telomere length will not be maintained, because telomerase enzyme is gonna maintain the telomere length, na? When telomere lengths are getting shortened and shortened and shortened, cell dies. Cell dies, that is contributing towards the aging. Okay, so whatever was the question, that is related to this. Stress hormones, telomerases, and the aging. Right? And now you know there are 4 stress hormones, and what specifically cortisol does, break down the skin collagen and the elastin. Okay, we know the concept, right? We know the concept. They are not going to ask the same question again. They will rephrase, or they will do the reframing of this question. So if you know the other things related to the topic or related to this question, that is going to help you in the upcoming exam. Okay, let's move forward. McArdle's disease is due to which enzyme deficiency? McArdle, muscle, myophosphorylase. Okay, John, taking white wine reduce aging. What is the exact mechanism? John, why don't you send me a message on a Telegram, and then I'll share a paper with you which is exactly telling you which chemical composition, what is there in the white wine, which and how it is helping to reduce it. On the top of my mind, I don't know, because I don't drink, so I have never taken that into account. Yes, Aditi, telomerase is the most common molecular cause of aging, and the stress hormones reduces the telomerase concentration. Dr. Anish, myophosphorylase. McArdle is due to which enzyme deficiency? Do you know the other choices? And we have discussed that, right, in the top 10 topics. McArdle is because of the skeletal muscle glycogen phosphorylase, right? And what do you see? Increased glycogenin. That is one of the recall question aims ka. And the myoglobin urea. But the blood glucose remains unaffected. If they give you the clinical case scenario, blood glucose level is the same. Okay, glycogen phosphorylase and hexokinase were another options. Acha, TFK, phosphofructokinase, maybe, but this was very straightforward. Simple ही था ना, kind of a one-liner. They are telling the McArdle. McArdle is because of the myophosphorylase or muscle phosphorylase. Glycogen phosphorylase was there. If they have given you the glycogen phosphorylase, which glycogen phosphorylase? In the muscle or the liver? It has 2 isoforms. It has 2 isoforms. ठीक है. If they are giving you muscular glycogen phosphorylase, that is a correct choice. Myophosphorylase is another name. अभी McArdle is because of the muscle, no? ठीक है. Let's move forward. Changing, right, liver and hepatic, one and the same thing. The muscle and muscular or the hepatic. Okay, only glycogen phosphorylase was there. Okay, then Shweta, you are right. If the glycogen phosphorylase was their option and they are not giving the myophosphorylase, okay, then you definitely go and pick the glycogen phosphorylase. If they are giving you the myophosphorylase, see, by default, when we are talking about enzyme, the major site of all these things that is happening is the liver. Liver में सबसे ज़्यादा जिसको कहते हैं ना, all of the recycling, breaking down, all that is happening. So by default, it is usually the liver. If we are specifically talking about the muscle, they should mention it. The choice should say it. Who is saying the nonsense, right? Stop codon does the nonsense. Because nothing happens afterwards, during the process, nothing happens during the process of the transcription and the translation that is going to make sense because of encountering of the stop codon. So the entire system, entire process is a nonsense. Okay, Shweta, pick myophosphorylase. That is more appropriate. Glycogen phosphorylase can be used for both muscle and the liver. Since they are specifically giving myophosphorylase, pick the myophosphorylase because that is muscle glycogen phosphorylase, right? Synthase तो हो ही नहीं सकता है, right? So NMK, KSH, so we are not talking about that. ठीक है? So it is the nonsense codon. अभी हम codon पे हैं. We know the mutations. Mutation is a silent mutation, very simple guy. ठीक है, mutation is there but doing nothing because the same amino acid is being replaced. Missense mutation में it is not like too much is not happening. Similar kind of entity will replace. It is like a girl is missing from a group dance, another girl will replace. So overall effect is nothing. So it is like a missense kind of a mutation. Then the nonsense mutation is the khatarnak kind of a mutation, because that leads to a truncated protein and that protein will be smaller in size or a bigger in size. Smaller in size. ठीक है, that will be smaller in size. Vitamin deficiency, bite or spot. Simple. Everybody knows it. Please ये गलत नहीं किया होगा. I swear. You should not get it wrong. ठीक है. Let's move forward. I have few more questions. It's almost 1 hour. ठीक है. Now there was this question, and the students were telling me there was this alcoholic person on the isoniazid therapy, tingling sensation, and they were asking you about the vitamin deficiency. But few students told me there was this peripheral neuropathy was also given, written. Harjeet, yes. Meningococcus, yes. Nidhi Punia, yes. Gaurav, right. So you all know the answer. You all know the answer. Vitamin B6 deficiency is usually if it is drug induced, it is because of the isoniazid therapy, right? And what do we do as a supplementation? We either give the pyridoxine, that is vitamin B6. Now, it was written alcohol but not much. ठीक है ना? because alcohol is to trick you. Whenever they are talking about the alcoholic person, first thing that comes in our mind is thiamine deficiency, right? So don't get tricked by such keywords. You have to read the entire thing. I mean, they are telling the isoniazide, they are telling the tingling sensation. We know it is for sure कि क्या होने वाला, that is vitamin B6 deficiency, right? PLP, right? Pyridoxal phosphate is the coenzyme form of the vitamin 6. You should know the vitamin name and the coenzyme name separately, both पता होने चाहिए. Now there was the question about the rice water diarrhea, right? Rice water diarrhea intoxication is due to which ganglioside? I have just recently, like we were discussing in T&D, and this was the question जो discuss किया था, right? There was the boy who went out in the shore, ate clams. Soon after, he developed watery diarrhea, vomiting, leg cramps. What is going on? Activation of stimulatory G protein. Now, this time in this question, they have asked you about the receptor. Receptor is GM1 ganglioside receptor. This is related to cholera toxin. In us, we have the receptor on the cell membrane for the cholera toxin, right? All the other animals, the cows, the buffaloes, the goats, and the sheep, they don't have the receptor. When the receptor nahi hoga, then the cholera toxin cannot bind. Toxin to under it can enter. Toxin is what? Toxin is like a intruder, terrorist, right? Terrorist will come inside your home via the cell membrane. Cell membrane is your ghar ka gate, is the gate of your house. So if you have a gate, cholera toxin can open it and can come inside and cause the diarrhea. Sheep, cows, buffaloes, they don't have that. We have it. We are humble people. We have a gate for our home. So toxin comes and binds to it, right? That is GM1 receptor. And toxin has A and B. B binds to the receptor and this A red part gets internalized. That does what? That does a lot, cascade of events, और जितने भी ions है, all ions, the sodium, chloride ions, everything, bicarbonate ions, they move out of the cell, right? So outside the ion concentration is now very high. High concentration of iron will lead to what? The sucking of the water from everywhere. That is leading to the massive watery diarrhea. And that diarrhea is what? That diarrhea is rice water diarrhea. That how the poop looks like. GM1 and GM2 nahi karo na confuse Harjeet. We have GM1 receptor for cholera toxin. Just remember that. See, you have GM1, GM2 and GM3. These are the 3 gangliosides. Remember that. And GM1 is the receptor which receives the cholera toxin. One है ना, first आता है, तो कहता है I'll come first and I'll open the door for the cholera toxin to come inside and cause me the diarrhea. Right. Gangliosides are usually in the brain. Most of the gangliosides. Shraddha. ठीक है? There is one more question. One more question was about the fatty acid transport via intermitochondrial membrane. One option was something related to the carnitine, another was related to the acyl carrier protein. Do you know the choice C and the D? कोई बताएगा D, C or D choice में what was it? क्या था? Okay, Shiv, Rajani, Vivek. Okay, high protein diet was not there in the option, तो वो option नहीं होगा, carb होगा. Carnitine, the rate limiting enzyme. LCAT, Gaurav. Okay, so this is from the video. So what I have here is, I'm gonna use the blue color. बाकी सभी colors हैं इसमें, ठीक है? Inner mitochondrial membrane. So inside you have, this side is the matrix, this is outer mitochondrial, this is the cytosol, right? This question is indirectly related to how we are when the cell knows when to do the beta oxidation of the fatty acids and when to do the synthesis of the fatty acids. So who is the boss there? Who is the referee there who will decide what is going to happen? Who decides? CPT1, CPT2. That is carnitine palmitoyl transferase 1, carnitine palmitoyl transferase 2. CPT1 is in the outer mitochondrial membrane. CPT2 is in the inner mitochondrial membrane. If they specifically give you out of CPT1 and CPT2, and in the question they are asking you about the inner mitochondrial membrane, so you will pick what? You will pick CPT2. Otherwise, carnitine is enough. It is not an acyl carrier protein, but it is. Okay. Healthy and healthy lifestyle. Singing Dr. Deep Shah. Okay, Dr. Deep Shah, one option was cholesterol transporter. RBC to cholesterol. Acha, RBC say they are transferring the cholesterol. But fatty acid is transported across the mitochondrial membrane via the CPT1 and CPT2. Okay, Dr. Anish. So, but you are getting the essence, right? CPT1 and CPT2 controls it. Oxidation, beta oxidation takes place in the mitochondria. So during the synthesis, if there is a free fatty acid that is being synthesized, so what it does, there is kind of a flap thing, it closes the flap so that synthesis takes place. Alcat. IMM was not mentioned meningococcus, but Sarthak said it was IMM. I do trust him. Pata nahi. Maybe the mitochondrial membrane was said, not the inner mitochondrial membrane. Maybe just the mitochondrial membrane. They were not talking about the inner mitochondrial membrane. IMM was mentioned. Say Jay was saying, Manoj was saying. RBC transfer for cholesterol, right? And the cardiac muscle was mentioned, ma'am. It was mentioned IMM, right? I trust Sarthak. He's one of your toppers, no? Okay. Now, the whole point was, the question was trying to say you that the cholesterol has to be transported, okay? RBC. RBC transfer. RBCs don't have the mitochondria. Well, we know for sure, right, that the fatty acid transport through the inner mitochondrial membrane or mitochondrial membrane takes via CPT1 and CPT2. Okay? If this was the question. And if they are asking you, they have to transport the fatty acid in the RBCs. RBCs don't have mitochondria. So now I am confused. There was no mention. Thank you, Shraddha. Thank you. RBC hoga meningococcus, but maybe they were trying to say something else. Just get the theme. Important kya hai? Important thing is we have to know who is the transporter. Okay? Rest is the story. Don't worry about the story. Focus on the main thing. who transports? CPT1 and CPT2 transports. If it is outer mitochondrial membrane, it is CPT1. If it is an inner mitochondrial membrane, CPT2. ठीक है ना? Let's make our life easier. Are we okay now? Right. Let's be on same page. What was given is not a point exactly. The point, the examiner wanted you to know who does the transport. If you know the transporter name, rest everything is just fine. Okay, don't worry about all those other things. Cardiac muscle. Thank you, Rupesh. So they were asking about the cardiac muscle fatty acid transporter. Okay, Hitesh. This is crazy. Gluten-free diet is the answer. Without reversing the damage, fat absorption won't take place. High protein is definitely not the answer. Okay, Hitesh. I don't want to argue with anybody. See, my last rescue is usually the research paper, right? And that they are the most updated page. So I am just agreeing with you based on the fact that you guys are reading from the book. Probably the authors who are writing the book, the writers, they have not updated this yet to you, right? So just stick with the high gluten diet, right? So because the examiner is going to grade you based upon what you have read from the book. I was talking about based upon what I have read from the research paper. That is the most updated knowledge. Now you have two aspects. Getting the grades is from the book. Being updated will help you to be more professional doctor when you are really in a really with the patients. ठीक है? Let's not go beyond that. ज़्यादा हो गया है. Let's not go beyond that. There are few things, and also the gluten thing depends upon person to person also. Okay, person to person also. Let's not argue. Let's stick with the protein, this high gluten diet. Okay. So I guess I am done, right? And I would like to thank you very much. You are such a sweetheart. You helped me a lot, and for after such a long time, I really felt that I am talking to you guys. No, Harjeet, we cannot say the NEET examiners are not much updated. The examiners are updated. See, this is the process. If let's say research come today, it is going to take a while, maybe a year, so that it is written in the books. So when you will grow older in your profession, or you are being more experienced person, you will get these updates directly in your mailbox by the scientists, so that you are more updated. Right now you are just a student, so you have to stick with the books, and getting the updated knowledge overnight in the book is not possible. Practically कैसे possible होएगा? Abhi research just came, it will be transferred over to the authors, then they are gonna make the book. Book publishing itself is a long process, ठीक है ना? So don't worry about that. Our worry is to get the good grades in the exam right now. We will stick with the fact that is given in the book, right? And we will update our knowledge so that we can apply it with the patients. Does that make sense? And I would like to thank you, all of you, to be here. Have a wonderful Sunday evening. Those who have taken the exams, just go and party. Yes, I'm gonna go and party too, right? Jaundice question was there. Obstructive jaundice. I don't know about that question, Lavanya. I guess, was that a biochemistry portion question, or maybe an integrated question? That is why. I'm gonna have a glass of red wine. Come on, cheers. I have the bottle if you want to come and join me. ठीक है? Lavanya, share me the question. Please write the question in the chat box or just send me the telegram mein. Whatever is left, we will take it in the telegram. Okay, this is my telegram ID, right? This is my telegram ID. We will take it from there. जो भी रह गया. Okay. Thank you and have fun. Bye bye.